to say that sleep is the foundation upon which the other pillars of health are built on. So, obviously, nutrition and exercise are so important to living a healthy life, but they only go so far when you're not getting enough sleep. If you think about nutrition, for instance, when you're not getting enough sleep, you trigger an increase in the release of ghrelin, which is a hormone that signals to your body that you're hungry. And you also release less leptin, which is a hormone that signals to your body that you're full. In a state of insufficient sleep, you value instant gratification. So it's much more likely that you'll make poor food choices. And your blood sugar is dysregulated. Your body is less sensitive to insulin. And so you have hormonal dysregulation. So even if you're doing everything right in terms of nutrition, you're actually starting behind the ball by not getting enough sleep.
Hi, I'm Lauren Parsons.
And I'm Andy Jackson, and this is the All Well Co podcast.
Dive deep with us as leading experts share their unique perspectives on topics such as recovery, sleep, movement, and the latest innovations in the space. Dr. Holliday-Bell, we're so excited to have you on the All Well Co podcast today. Thanks for joining us. To set the stage a little bit, can you share what drew you into sleep medicine and how that journey maybe has evolved alongside becoming a mom?
Absolutely. So I actually started in the field of sleep through my own struggle with insomnia. So as I was going throughout medical training, specifically medical school and really residency, I started to suffer from insomnia. And I always say I've done a lot of difficult things in life, right? Like it's not easy becoming a doctor, but the most stressful and frustrating thing I've ever been through is insomnia. So struggling to sleep. And so I started on my own quest to fix my sleep, started reading every book I can get my hands on about sleep, started to actually volunteer in the sleep clinic in my hospital. And as I was learning more about sleep, I really fell in love with it and understood that it was more than just about feeling rested. Like it really was the foundation of living a healthy life. And so I started to put the practices into place I was learning about. And then sleep would come up in almost every kind of visit, every patient visit, friends, family, like sleep was always coming up. So it reinforced that it was a bigger issue than just what I was going through. And so I knew that I had to help other people find the success that I've had in fixing my sleep. And so, I've been on that journey for a long time. And then becoming a mom has been an entirely different experience as it relates to sleep. Even as a doctor and sleep specialist, people would always say, oh, but wait until you have a baby. Then all that sleep stuff goes away. And so it became my mission, even before having my son, to prove that motherhood didn't have to look that way and to just, claim the fact that, no, I'm going to still be rested. I'm going to make sure my son gets sleep. And so I followed along that path. And it's been a very interesting journey and has also led me to this other segment of my business where I'm really helping moms specifically because I do feel that they are almost this lost demographic that people, say, of course, you're not going to sleep. You're a mom, a working mom. So, just that
Get
just
over
is what
it.
it is.
Yeah.
And so I'm teaching them that there is a better way.
Somebody else here has a
Yeah,
just
I
under
can relate.
1 year old. She's
Yeah.
a
Okay.
1 year old son, so just got a little one as well. So,
Yeah.
Well,
How old is
nice.
your son?
He'll be 11 months at the end of this month.
oh, you
We're
two are the
just a month
same.
apart. Yeah,
Yeah.
we're just a month
Wow, look at
apart.
that.
Great.
Yeah.
Okay. So I understand maybe what you're going through a little bit too.
Uh-huh.
Yeah. Awesome. So if someone is consistently getting poor sleep, but still functioning, right? What's actually happening under the surface?
I think functioning is an interesting term, right? Because I will often speak with people, clients, or some of individuals I work with my corporate engagements, and they'll say, "Yeah, I can get by off of 5 hours of sleep, or I can make it off of 6.5." And I'm like, "What does it mean to get by and make it though?" And often that is you're pushing through your day. There's this brain fog. You're constantly trying to redirect your attention. There's like a motivation, lack of energy, and even for people who feel that they are doing okay and maybe not necessarily having all of those symptoms at work, they get home and they crash and like they've used up all of this energy, the reserves that they had. And people feel that they're functioning fine because when you're not getting enough sleep, you actually trigger your body's fight or flight stress response system that sounds the alarms and triggers a release of cortisol and adrenaline because your body's saying, okay, we're under some sort of danger or threat. Let's make sure that we are alert in case we need to act. So, of course, that's going to give you this false burst of energy because it's your body staying on high alert. One, that can only last so long, which is why most people have that crash. And two, it's not healthy to be surviving off of those hormones consistently being released. So even if you're like, oh, it's okay, I can push through, that's really what that means to push through.
Yeah.
So, if you take sleep and let's rank it against, let's say, nutrition or exercise for your overall health, where does it really fall and why?
I like to say that sleep is the foundation upon which the other pillars of health are built on. So, obviously, nutrition and exercise are so important to living a healthy life, but they only go so far when you're not getting enough sleep. If you think about nutrition, for instance, when you're not getting enough sleep, you trigger an increase in the release of ghrelin, which is a hormone that signals to your body that you're hungry. And you also release less leptin, which is a hormone that signals to your body that you're full. In a state of insufficient sleep, you value instant gratification. So it's much more likely that you'll make poor food choices. And your blood sugar is dysregulated. Your body is less sensitive to insulin, and so you have this cortisol or these hormonal dysregulation. So even if you're doing everything right in terms of nutrition, you're actually starting behind the ball by not getting enough sleep. Similarly with exercise, of course, exercise is important, healthy heart, healthy body. But when you're not getting enough sleep, your needs or your non exercise activity thermogenesis that accounts for the bulk of the calories you burn from taking stairs, walking, fidgeting, the way that I'm moving with my hands, that all decreases when you're not getting enough sleep. Growth hormone is produced overnight, specifically during that slow wave sleep. And so, if you're not getting enough of that, you get less growth hormone, which is needed to rebuild muscle tissue that has been broken down as you're like lifting weights and repaired stronger. That process is less efficient. So, you can eat well and exercise, but those things are going to be less optimal if you're not getting enough sleep.
And do those two things affect sleep? So if I'm having a poor diet and I'm not exercising, is that fundamental to poor sleep?
Yeah, so I would say it definitely contributes. I wouldn't necessarily say fundamental, but for sure can contribute, and there can be this bi-directional relationship. So particularly when it comes to exercise, what we do know from research is that participating in exercise does increase that deep, slow wave sleep. So it improves your sleep quality. It can help you fall asleep faster. There are nuances about the type of exercises and when you do them, but what we know is big picture exercise does help sleep. And then nutrition, it's about what you eat in timing, to sleep.
Timing.
So,
Mm.
you eat foods that are if you eat a really heavy meal close to bed, your digestive system is gonna be too active. You may have reflux and heartburn that can impact sleep. Certain, like, variations in blood sugar, if you're not eating enough and your blood sugar drops, that spikes cortisol, that can lead to middle of the night waking. So, there's a timing thing more so and a value, but they do often go hand in hand.
Yeah. I can totally relate to what you're saying with, having a little one where you might only get 3 hours of sleep, then you crave carbs, right?
Yeah.
And
Yep.
then you start off on the wrong foot, and then you're too tired to work out, and then you kind
Exactly.
of just go through this cycle. So it's really interesting from a scientific perspective, at least what's going on under the hood. 'Cause practicality purposes, right? I'm doing it, or I've done it. So,
Mhm.
yeah.
Exactly, exactly.
Interesting. So a lot of people, they do feel tired, they feel exhausted, they can't fall asleep. So what's going on physiologically there?
Yeah, so, there can be several reasons why someone can feel tired and not be able to sleep, but I think often it comes down to increased alertness or hypervigilance as we get closer to bedtime. So your body is very sophisticated and intelligent in that, primitively speaking, if there is a threat, even if it's the middle of the night and I am knocked out, dead tired, if there is a bear coming charging at me, my body's going to override that tired system because it's more important for me to get out of danger than it is for me to be sleeping right now. Sleeping leaves me vulnerable. And that is still hardwired within us, even if there is no bear. So if you've gone through your day stressed and anxious, or some people just have anxiety surrounding sleep itself. Sleep has become so much of a battle and so much of a struggle. And this was the case for me too when I was struggling with insomnia, that just getting into the bed is what led to the anxiety and the
Mm.
stress and the hypervigilance. And so my body thinks, oh, well, there's a bear coming. So we can't go to sleep. Even though I'm tired, I need to override that tiredness because I need to make sure that I can respond. And so the way you manage that is it depends on the cause. If it's really a sleep anxiety and you have chronic insomnia, you need to manage that. And the best way to do that is something called cognitive behavioral therapy for insomnia. I would say for the average person, it really is giving your brain and your body a transition point from the high alertness, stress, problem solving, task jumping of the day to then the calm and peace of the night. Most people go from just being busy and working in their mind racing to just, okay, the lights are off and now I'm just supposed to fall asleep. And there are some amazingly lucky, beautiful individuals who can do that. But for a lot of people, they really do need to give their brain that transition point to say, okay, we're okay, we're safe. The stress of the day is gone, and now we can allow ourselves to fall into a deep sleep.
So in simple terms, stop worrying about the worry, and that'll
Stop
help you
worrying about
fall
the
asleep.
yes. Yes,
That's a
stop
good
worrying
point.
about the worry.
Yeah,
Yeah, a good way to say it
yeah.
anyway. Yeah. So you might have already mentioned it, but I'll ask anyway. What is the most common mistake you see people making with their sleep right now? Is it not having a transition period like you said, or is it something else?
Yeah, I think it's not having a transition period, and honestly, I think it is waiting until nighttime to start thinking about your sleep. So when I'm working with clients or I'm coming in to speak, people are always surprised when I say sleep is actually a 24-hour process. It's more than what you do at night. So there are so many things during your day that impact your sleep before nighttime even hits, before the sun sets. And so if you are waiting until now it's roughly bedtime, okay, I guess I'll just try to figure out how to sleep. You're already behind the ball, and there are so many things that could have impacted your sleep up until this point. So I think that's the case. In addition to not giving yourself that transition time, is understanding that what you do, the time that you wake up in the morning, getting natural light exposure, your meals, exercise, all those things also significantly impact your sleep. And so you want to, I say, start your day with sleep in mind, is what I say.
Sure. Yeah, that makes a lot of sense. So if someone wanted to dramatically improve their sleep starting tonight, what are the 2 to 3 highest impact changes you'd recommend?
The best thing you can do for your sleep, and again, a lot of people are surprised when I say this, is to wake up at the same time every single day. So it is more important that you wake up at the same time than it is to go to sleep at the same time every day. Your circadian rhythm, or that roughly 24-hour cycle that dictates when you feel awake and alert, typically during the day, and then when you feel sleepy at night, the best way to reinforce that is by waking up at the same time every day. That helps to tell your brain and teach your circadian rhythm when to send those alerting factors, when to turn off melatonin, when to send melatonin later at night, and is the best way to reinforce that cycle. When I say same time within an hour from day to day, it's okay, but you don't really want to have more than an hour variance. The next thing is to actually get some sort of natural light exposure within an hour of waking. Again, both daytime factors, right? Nothing to do
Mhm.
with nighttime. Light is the strongest factor that influences your circadian rhythm in a way that tells you to be awake and alert. So light can be used as a tool to help reinforce your circadian rhythm and get your sleep on track, but is often used as a way that inhibits your sleep. So light exposure first thing in the morning, ideally that's like getting outside, getting actual natural light, going for a walk, having your morning coffee on the porch. But I'm in the Chicagoland area, and for many months during the winter, there's no lights when I wake up in the morning. So using a light therapy box or light therapy glasses is a way to simulate natural light exposure, but again, is a great way to really entrain that circadian rhythm. And then the last thing is bedtime routine. Having something that you do that transitions your mind, your body from the day and stress of all the things that come with that to the night, and specifically your bedtime and sleep. Whatever amount of time you can consistently dedicate, if that's 15 minutes, great, but just do it every single night and make it consistent.
And is there something or some things that maybe you shouldn't do for your routine to just stress yourself out again? Like, are there do's and don'ts for that routine?
Absolutely. So, as amazing and great as natural light exposure is in the mornings, not so much at night when you want to be going to sleep. And so, a lot of people have already heard that you shouldn't be on your phone or your laptop because of blue light. And that is true. The blue wavelength of light, right? Light is made up of all these different kind of wavelengths. The blue wavelength, which is richly emitted from electronics, has the strongest alerting effect on your circadian rhythm. So that particular wavelength is sending signals to your brain that it's daytime, wake up. However, where a lot of people go wrong and what they miss is just existing in normal room lighting. So the lighting that I'm in right now in my office, lighting throughout your house also can have alerting effects on your circadian rhythm. And research shows if you're exposed to those lights within a couple hours of bedtime, can delay your natural melatonin release by up to 90 minutes. So yes, avoid electronics, but also dim the lights. Use low emission table side lamps. Like you want to start setting the tone that we're entering into evening. Let's start, secreting melatonin, and that's the way to do that. And then also understanding that not being on your phone is not just about the blue lights, but it's the stimulation that comes from it. Oftentimes it's social media, but it could be emails, it could be, answering work things. And so you're teaching your brain to be active in problem solving or stimulated at a time when everything should be slowing down. So your bedtime routine, you want to keep it low light, and you definitely want to avoid stimulating activities.
So I was fascinated that when Lauren asked you the question about 3 things, you went straight to 2 about the mornings, and they were
Yeah.
nothing to do with night. I would have expected you just give the response you just gave about
Mhm.
nighttime lights dimming, going from cold to warm, all of the things that people kind of think. So let's dig into that a bit deeper, and let's like our audience, we have a lot of professionals like you. Get up early, have to be in practice, have to be seeing their clients at 5:30 in the morning because the clients are going to work, whatever it is. So talk about their morning routine. What should they think about in their wake up routine, particularly when it's early that they have to get up? So it could be
Yeah.
dark a lot of the time.
Yes. Yeah, you hit the nail on the head. Like I said, people are so surprised when I say, "Oh, your morning activities are actually very, very important for your sleep, and often even more so than bedtime." But waking up at the same time. So, when I come in and I speak with clients, particularly those who have to get up very early, they're working with clients who are overseas or just on a different part of the country, and they have to start very early. Let's say they're waking up at 5:30 a.m. Monday through Friday, but then Saturday and Sunday, now we're at 7:30, eight
Yeah.
thirty because they
That
want
was
to
going to
sleep
be my
in.
next question.
Yes, and I get it. Of course, you want to sleep in or try to catch up on sleep, which you can't do unfortunately. But it's actually better for your sleep quality, your circadian rhythm to keep that wake time consistent, even on
Oh,
the weekends. And again,
no.
it sounds like, "Oh my gosh," but what I always say is it is when I come in to speak with these people, they are struggling Monday through Friday. Like, I'm trying to get through, I'm sleep deprived, I'm struggling, and they live for the weekend where they can get an extra few hours of sleep. And so I'm like, would you rather live that life or get good sleep 7 days a week, right? Like,
Yeah.
yes, it seems early, but if your sleep is on track and you're getting good quality sleep, it won't feel as horrible, and you don't have to live 5 days waiting for the 2 days where you can try to catch up, and then Monday's even harder because now you've thrown your schedule off. So it is a bit of a sacrifice at first, but once you entrain your circadian rhythm, your body will naturally start to wake up at that time. So it really isn't that difficult in the long run. But
Yeah.
that's the first thing. We have to keep that wake time consistent. Get natural light exposure. And again, it may be dark, so light therapy box, light therapy glasses help to simulate that natural light exposure. All you need for most devices is 15 to 30 minutes. So if I'm using my light therapy box while I'm doing my morning routine, I just have it in front of me. I'm getting ready. If I have to be moving around, I'll throw on my glasses, but that also helps to get some light exposure. I also say plan something enjoyable for the morning. So I like to listen to my favorite podcast, something that does stimulate me as opposed to nighttime, where I feel like it gets me going and it's like, oh, I'm looking forward to hearing this. For some people, it's your favorite energizing, playlist. It can be, your cup of coffee in the morning, whatever you enjoy. Plan something that you look forward to so that mornings don't feel like this punishment. And then I would say, lastly, what can be helpful? Some people have what we call sleep inertia. And it's this like groggy, disoriented feeling when they wake up in the mornings, particularly if they're waking up at a time that's much different than when their body would normally want to be waking up. So using something like a sunrise alarm clock that is meant to wake you up naturally from a lighter stage of sleep can be helpful because that helps to prevent getting awakened abruptly from a deeper stage. And it's just a more natural wake up that feels better.
Mm.
Hmm. So I am, let's just say, moving towards a different decade of my life, or I've moved in a different decade of my life,
Mhm.
and I have to wake up in the middle of the night, 2 or 3 o'clock, need to go to the bathroom. And then
Uh,
sometimes I struggle to fall back asleep. What should I do actually in that moment that helps me get back into that sleep? I like to get up at 6:30. So let's say I wake up at 2:30. I've still got another cycle of sleep that I should be getting. What advice do you give me to actually do at that moment if my mind starts thinking about work or I start,
or
you
you just
know,
feel too
or
awake,
just
right?
feel
Sometimes you
too
just
awake,
feel
just
too
feel too
awake.
awake. Yeah.
Yeah.
Yeah. So when people tell me they wake up in the middle of the night, there are a couple of things that we talk about. The first thing is to educate on the fact that we all wake up multiple times at night, often around that 2 to 3 hour or 2 to 3 a.m. mark. And most of us don't necessarily remember those wake ups, right? We might change position, fluff our pillow, fall back asleep, but there is a brief awakening as we transition between sleep cycles. The reason that this is important is because some people get anxious about the fact that they're awake. So I'm awake. Oh my gosh, why am I up? I should be sleeping, and it's going to take forever to fall back asleep. And this triggers this spiral. Again, now we've understood that we're unsafe. We can't fall asleep, and so understanding that this is not inherently abnormal can help to quell some of that anxiety before it spirals. The other thing is, when people tell me, I say, "Okay, you woke up in the middle of the night. What time?" And they say, "Oh, 2:33." And I'm like, "How do you know?" And it's because I look at the time. And it's like, that right there is part of the problem. Do not look at the clock or the time when you wake up in the middle of the night.
Oh, interesting.
Because as soon as you do, it triggers this countdown anxiety where your brain is like, "Oh, 2:30, I have to get up at 6:30. Okay, I have 4 more hours. Let me try to go ahead and go to sleep, because if I go to sleep right now, I can get 4 more hours." And then you're still awake, and you're like, "Oh, shoot, now it's 3 o'clock. Okay, let me hurry up and go to sleep, because now I have 3.5 more hours." And it trigger even if you're not intending to do that, the brain automatically does that. And again, it increases that anxiety. It makes it less likely you're gonna fall back asleep. So I learned this the hard way when I was struggling with insomnia, and I can literally say for years, for at least a decade now, I do not look at the if I wake up in the middle of the night, I have no idea what time it is. If my alarm has not gone off, it's not time to wake up, is what I know. So it could be anytime. I do not know. And then when you're waking up to do something like go to the bathroom, or as a mom, I'm waking up to feed my child, it's important not to engage in activities that stimulate you during that time, including turning on the light. Obviously, you have to see, right? I have to see when I'm feeding my baby, I have to see when you're going to the bathroom. As an aside, I would say prior to having my child, I just kind of felt my way around. Like I was a mime in the middle of the night. I
Mhm.
was like, I will never turn on the light. But you can use motion sensor lights. Red light is great because it has the least alerting effect on your circadian rhythm and can help keep your melatonin secreting. So I say if you have to use some sort of light, just have a tableside red light so that you're not turning on lights and signaling to your brain, I guess it's time to wake up, right? Some people treat middle of the night wakings like an alarm clock, because when you do things that stimulate you, it's almost as if you're setting an alarm to wake up. And what happens if you're consistently setting an alarm to wake up at the same time? You're going to start waking up at that time naturally. So keep things low stimulation. When you feel your mind wandering, try to anchor it to a neutral activity or neutral thoughts. When people wake up in the middle of the night or even in the beginning of the night and they can't fall asleep, they have this misconception that they should not be thinking. I have to turn my mind off. And that doesn't work. Our minds don't just turn off. Actually, our minds are very busy while we're sleeping. The thing is, you don't want your mind to be problem solving, thinking about work duties, thinking about other things that are stimulating and engaging. So you want to give your mind something neutral to think about. So that can be a cognitive technique, like cognitive shuffle is one of them. It can be listening to a sleep story, a sleep meditation, someone else that's guiding you through thinking about something else until you're able to fall back asleep. But just give your mind a neutral anchor, and all of those things should help you fall back asleep quicker.
Mm. Yeah, I make the mistake right now of looking to see what time it is, and I'm like, "Oh, shoot, I have
Most
4
people do.
hours," right?
Yeah,
And then
me too.
Louis will wake up an hour later, I'm like, "Great, I have 3 hours," and then I sit there and I just watch my phone the whole time, and, it's funny having a child because prior to, I'd say sleep used to be my superpower, but now it's,
Mm,
something that I probably have to learn as a skill a little bit again because
mm.
it's so disrupted, or it's
That's
been so
so
disrupted for so long.
Exactly.
So
That's so many mom stories, which is also part of the reason why that the demographic holds a special place in my heart. Up to 40% of women have insomnia 2 years after their child is born. And in the first 3 months, we expect that. Your baby's waking up every 2 to 3 hours. You just are in survival mode. But beyond that, it really shouldn't be the case. But like you said, there's so much time spent with sleep disruption, and then we don't teach moms how to regain control over that sleep again and relearn that skill in a different setting of life. And there's a lot of hypervigilance and anxiety that comes with that because now you have a child to take care of. So it really is such a common factor in women in general having insomnia, and 40% more likely to have insomnia than men because of this.
wow.
Oh, wow.
I mean, I guess that makes me feel terrible, but less bad that I'm not alone.
You just
Yeah.
think about it though, once Louis gets older, he's gonna sleep longer.
Yeah.
You've still gotta get up at 3:30 in the morning, according to Angela, so you're gonna get 4 hours of, time between
Yeah.
3:30 and 7:30 to do
Yeah.
whatever you like,
I'll
Laura.
figure it out.
There
Yeah.
you go.
I'm a mess.
I'm teasing, Angela,
Yeah.
I'm teasing.
Uh, that would be awful. Um, Switching gears just a little bit, can you break down what alcohol and caffeine are really doing to our sleep quality? We hear a lot from people that, "Oh, I feel like I sleep better sometimes if I have a drink before bed," or "Caffeine doesn't disrupt me before bed. I can have a cup of coffee, as an after dinner type of deal." So even if we feel like we're sleeping fine, what's really going on there, with those 2?
Yeah, let me start with caffeine because I think that's the biggest one. And whenever I mention this in my talks, I always start by saying I love coffee. Coffee is one of the loves of my life. I love the ritual of it. I love how it makes me feel. It actually makes me feel like relaxed and calm as opposed to like awake. But I love the ritual, and so I think that in the world of sleep, coffee is kind of vilified. It's like you can't drink coffee. You can absolutely drink coffee and indulge and enjoy because I personally do that as well. But I always say you have to drink responsibly when it comes to coffee and alcohol, of course. And so the potential problem with caffeine is that it has a long half life. Average is 5 to 6 hours, but for some people, 10 to 12. And that is the amount of time it takes for half of the amount you consume to be excreted from your system. So if you had a cup of coffee that had 400 milligrams of caffeine, then 5 hours later, you still have 200 milligrams in your system. And 10 hours later, you still have 100 milligrams in your system. Meaning, if it's afternoon or definitely evening time, and you're trying to have that little bit of a pick me up, that caffeine is still going to be in your system long after you're wanting to go to sleep. And most people drink caffeine for the alerting effects. So obviously, those alerting effects can impact your sleep. I am what I believe to be a fast metabolizer of caffeine. So I have never had a cup of coffee and felt like, oh, I feel so awake now that I've just never experienced that. I think I metabolize it fast, and some people also are fast metabolizers. With that being said, what research has shown is that even if you're a fast metabolizer, caffeine can cause you to remain in lighter stages of sleep. So even if you feel like it didn't affect me falling asleep, it can affect your sleep quality by being in the lighter stages. So even as someone who's never felt aware from coffee and I love it so much, I do try to avoid it afternoon because it still can impact my sleep quality. So that is what I'll say to people. A good couple rules of thumb is consume the lowest effective dose, meaning if 100 milligrams of caffeine gives you that boost of energy in the mornings, consume 100 instead of 400, and then try not to have it in the afternoon. And when I tell people caffeine has never woken me up, I've never like felt, and they're like, well, how do you feel rested? And I'm like, by sleeping, right? So we can lean on sleep and getting quality sleep to feel rested throughout our day as opposed to needing caffeine to do that. Alcohol, on the other hand, is initially a sedative. So it will make you sleepy. The problem is that it's broken down pretty quickly within 3 to 4 hours and then becomes a stimulant. So it leads to broken sleep, middle of the night wakings, early morning wakings, and it is specifically a REM sleep disruptor. So what we find and we see in like lab studies and things like that is even if someone feels like, oh, I fell asleep fine, I stayed asleep, that REM sleep is particularly impacted and that is poor sleep quality. But again, same rule of thumb. Try to limit, 1 glass of wine instead of 3 glasses and try to have it much earlier, 3 to 4 hours before your bedtime instead of right before.
Angela, you mentioned light sleep, REM sleep, etc. There may be listeners here who don't understand the different types of sleep and the different stages. Could you explain that, please?
Yeah. So when we are sleeping, we cycle through 4 different stages of sleep. So you start with N1 sleep, which is a very light sleep. It's like that sleep that you kind of like blink your eyes and you wake up and like, was I asleep? Like that very, very light sleep. Then you go into N2, which is deeper. So this is when your breathing rate starts to slow down, heart rate starts to slow down, blood pressure starts to drop. We actually spend majority of our sleep in that stage, about 50%. And then you get into N3 or deep slow wave sleep. So if we're speaking very, very broadly and generically or generally, that sleep is going to be the most restorative for your body. So that's when growth hormone is released. That's where your body really feels restored. And then you have REM sleep where most dreaming occurs, but not all dreaming. And that's going to be, again, generally, broadly speaking, most restorative for your mind. And there, of course, is overlap. There's been a lot of attention recently about REM sleep. Everyone's so obsessed with REM sleep. And what I try to get people to understand is every stage of sleep is important. Every stage of sleep has its own functions. We spend most of our time into sleep. And so instead of trying to specifically target a specific stage, it's really about setting yourself up to have good sleep quality in general. And your body is very, again, intelligent and will plug and play the stages that you need. Now, there are things you can do to disrupt those stages. Again, sleep is or I'm sorry, alcohol is a REM sleep disruptor. Certain medications are REM sleep disruptors. And so you want to avoid things like that. But in terms of targeting a specific area, it's really just about generally meeting your sleep need and getting good quality sleep as a whole.
Thank you.
Yeah.
How much of today's sleep issues are behavioral, phones, stress, stimulation versus biological?
Hmm. I would say definitely there's both. I would say majority of them are behavioral for sure. And maybe there's like some biological overlap. But in the category of behavioral, I think is the sleep anxiety piece that I talked about. So, especially for people who struggle with chronic insomnia, it's not enough to say, don't be on your phone at night, get up at the same time every day. Like those things only go so far when your brain has connected your bed and sleep with an anxious, hypervigilant state. And it really comes down to kind of rewiring and retraining your brain to see sleep as a safe space and something that's restorative, and to work on those cognitions around sleep and then the behaviors that occur as a result. But if you don't have chronic insomnia, for a lot of people, it's not really prioritizing sleep. It's leaving sleep as this like last minute thing I'll do once I'm done, working and binge watching my show and scrolling through social media, and behaviors surrounding that. And then there are definitely some that have more sleep disorders, and it's more of a biological thing.
Okay. So my follow-up question would be, what the most common biological issue is, and that is that a sleep disorder issue?
Yeah, yeah. So I would
Okay.
say, even though technically we categorize chronic insomnia as a sleep disorder, when I talk about sleep disorder, it's more like physiological sleep disorder. So obstructive sleep apnea is going to be your most common outside of chronic insomnia, and that is where you have collapses of your airway that cut off oxygen supply to your tissues, and so you literally stop breathing multiple times at night, and your body again triggers even more robust fight or flight stress response system to say, "Wake up, we're not breathing, we need oxygen." But that doesn't allow you to really get into the deeper stages of sleep. It impacts your sleep quality. And then, of course, when you're repeatedly cutting oxygen supply off to your tissues, is going to have an effect on those down the line.
Yeah.
It's interesting because I have bradycardia, and, I wear a Loop monitor, and
Mhm.
it literally sends this information to my heart doc, and he showed me the data, and I said, "That shows that my heart stopped for 3 or 4 seconds." He went, "Yeah, Andy," he said, "Don't worry about it." He said, "LeBron James stopped for 13 seconds. Don't worry
Oh,
about it." That's what happens with certain athletes and stuff like that,
You're just that good of an athlete.
they can have it. So I just said, I said, "So basically you're saying I was 25% of an athlete like LeBron." That sounds about right. But,
that's a good way to look at it. It's all
it's
about
quite
perspective.
interesting, but the effect it has on me that wakes me up, I sometimes feel like I need to just, do some nose breathing just to
Mhm.
kinda get me back, and then
Catch
and
up.
I fall back to sleep. It's, 'cause my wife will often say to me, "Are you okay?" 'Cause you feel like you're excessively breathing, and I get it
Mm,
a lot. It's, I had
mm,
AFib and then had a ablation, and then that fixed the issues there, but I still get this, bradycardia, and seemingly people who've exercised, like, at a certain intensity, that's not uncommon, and that can affect your sleep.
mm.
Yeah.
Um, Hormones, especially for women in postpartum, high stress seasons, obviously that impacts sleep. What should they be aware of?
So, as I mentioned, I like to call it a gender sleep gap. There's a gender sleep gap that exists, in that women are much more likely to suffer from insomnia and sleep struggles. There is this misconception that women need significantly more sleep, like hours more sleep than men. That's not true. Women need maybe 15 to 20 minutes more sleep than men, but we are much more likely to suffer with sleep issues due in large part to hormonal changes,
Why
transition.
15 to 20 minutes?
We
Why?
don't know why exactly. It's unclear exactly the reason, but what we know is, like, in the studies that ended up being the average need was
I
15
see.
to 20
Okay.
which is, somewhat negligible, right? It's not like the 2 like, women need 10 hours of sleep that some people say, and men only need 7. Like, that's not really the case. And I actually say it's more important to look at the inter-individual variability than the intergender variability in terms of sleep need, because some men are gonna need more, some women are gonna need less. Like, there's more variance between individuals than between genders in terms of the sleep need. But in terms of how much sleep women are getting, there's a significant gap in that they are getting less. But there are hormonal shifts and changes that contribute to that, starting all the way back from puberty, actually. Puberty, pregnancy, postpartum, perimenopause, menopause are all significant transitions in hormonal status. Progesterone is a very important hormone for sleep. It helps to make you feel sleepy and get into the deeper stages of sleep. Estrogen helps with temperature regulation and also some other aspects of sleep. So, when you have those things that are either out of whack or are decreased around perimenopause and menopause, it definitely is going to impact your sleep. All of the things that I talked about still can help. So you still want to make sure you have healthy sleep habits. If you have chronic insomnia, it's going to be important to make sure that you're retraining those cognitions and behaviors surrounding sleep. But if you're, for instance, in perimenopause or menopause, then you may want to consider talking to your doctor about hormonal management of those things. There's, of course, hormonal replacement. There are other medications that are not hormones but can help balance the hormones. And so you do want to think about actively addressing that, but aside from that, really working on healthy sleep practices can almost like supplement the shifts in hormones, even during things like pregnancy, postpartum, and so on.
Yeah, I want to ask you a kind of generic question around this subject first, and then I think Laura and I will do this little quick fire thing where we'll
Okay.
just ask you about specific sleep aids, etc., and
Oh,
just
yeah.
in a few seconds, just give us an answer as to what you think of them. So there are all sorts of trends that take a nap, sleep trackers, supplements, optimization trends that help you or sometimes hurting our sleep. What's your overall view, so generic view first, about all of these different optimization trends that are being used?
I love that they're bringing attention to sleep. I think sleep was this forgotten aspect of health for so long, and now it's kind of moving towards the forefront. So I love that. I think you need to use them with caution. If you're someone who struggles with chronic insomnia or sleep anxiety, it probably I would take a less is more approach because you can become more anxious because of all the data. But if you're someone who's just like, I'm trying to live the healthiest, longest life I can, and whatever I can do to even increase that 1% and it doesn't impact you on an anxious level, go for it.
Okay, answers in less than 10 seconds or not. Magnesium for sleep.
Love it.
Ashwagandha.
I there are some studies that suggest it may be helpful. I would use it with caution, and it's not something I usually formally recommend.
CBD or CBN.
Certainly not enough information to recommend it widely, and studies are conflicting. For some, we found that it disrupts sleep in certain sleep stages. Some people sleep better, so I think that there just is more work that needs to be done to determine whether or not we should be using it.
Supplemental melatonin.
I like it in certain situations. So
Okay.
melatonin is a hormone of darkness that sets the stage of sleep and helps to train your circadian rhythm. If your circadian rhythm is thrown off because of travel, jet lag, time changes, or anything like that, short term, low dose can be helpful. Otherwise, not so much.
Mouth taping.
I don't like it. I don't like it. It is helpful to breathe through your nose. If you are not, then I would rather you have an understanding of why you're not and fix a root cause rather than literally putting tape on it. So I'm not a mouth tape fan.
I have a joke here that my wife would, she'll kill me when she knows I said this joke. So the whole mouth taping came from James Nestor from the book Breath. And there's a rumor is that he just did that as a joke to help all men to stop the women talking at night.
You've got a couple months till you no longer.
No.
Oh, okay. One more for you. One more quick fire for you. Cold therapy, hot
Oh, I
therapy.
was gonna say that one too,
Yeah,
yeah. Yeah.
You mean like cold plunges,
like
that kind
cold
of thing?
plunging versus saunas versus just
Oh,
throughout your
oh,
day.
okay. There's some benefits. It's not this like holy grail that people make it to be. Definitely cold plunges, cold showers can improve circulation and cellular things and stuff like that. I wouldn't say it necessarily has a significant benefit on sleep. Hot therapy, there is some benefit in that if you were to like take a hot shower, a couple hours, 90 minutes to 3 hours before bedtime, a warm bath, it dilates your blood vessels and helps to drop your core body temperature, which is actually helpful for you to transition to sleep and maintain sleep. So there is some benefit, I would say, particularly on the cold side as it relates to sleep. I don't think it is as significant as some people make it seem.
Yeah. Um, at what point does poor sleep become something that we should seek medical advice for? Like, what are the red flags?
So if you think you're getting enough sleep, but you still don't feel rested, so your sleep quality is impacted. So if you're like, I'm getting 7 to 8 hours, which is what I think I need, but I'm still tired, I'm not making it through my day, I'm napping, go get help. If you've been told that you snore and you wake up multiple times throughout the night, gasping for air, go get help. But I also I think people should have a much lower threshold to get help for sleep than they do. If you feel that even if you don't know what to do for your sleep and you're not getting enough sleep, go get help. And if you feel that you do and you're doing it and you're not getting the sleep you need, go get help, right? Like sleep is actually, as I mentioned, so foundational for your health that it's not worth struggling through it on your own if you're not getting the quality sleep you need. Go get help, talk to your primary provider, ask to be seen by a sleep specialist. There are things you can do, but I think that the threshold should be much lower than where it is for a lot of people.
Yeah. So you've talked about a ton of things people can start doing to help with their sleep, help their sleep quality. Without getting overwhelmed, someone's really struggling with sleep. What's if someone only changed one thing or started with one thing, starting tonight, what would give them the biggest return, or what's the one thing they should start with?
Hmm. Okay, I'm gonna answer this in two parts. Only
Sure.
because a lot of work that I do with individuals starts with mindset around sleep. I know it sounds so like everyone talks about mindset, but sleep is very psychological. And there are a lot of people who don't, who feel like they have to earn rest, or especially moms feel guilty around resting. And I want people to understand that, you deserve to sleep more than anything else. And starting your day with sleep in mind really helps you to be the best in all of your other roles. So, really understanding that you deserve to sleep, make sleep a priority. And I would say if we're starting tonight, so like not in the morning, then just having a simple bedtime routine. Not only is it a way to, help you transition to sleep, but you also are pouring into yourself. You're giving yourself back some time that is going to be helpful for something that's so restorative and that you need. So I would say start there. But also, I have a 7 days to better sleep guide on my website, thesolutionisleep.com. And the reason that I did this is because I wanted to break it down just fundamentally. What are some simple steps you can take just one night at a time that builds on each other, that ultimately gives you a healthy sleep routine so that it doesn't feel so overwhelming? And so you can just literally take it one night, one step at a time. That's free. You can go to my website and download that. But that's what I would say. Start with the mindset. You deserve to sleep. You need sleep to function at your best, one change at a time, and then build on it.
We'll definitely put that in the show notes, your 7-day.
Yeah.
Yeah.
That's, and can people work with you directly if they wanted to work with you?
Yeah, yeah, you can. So I have like sleep consultations and training. I also do corporate consulting. The best way to find all of that is on my website, thesolutionissleep.com. You can find ways to connect with me there to work, and I also work with children too, babies and sleep training. And then for the high performing individuals, I have a book called Sleeping on the Job: Proven Strategies to Optimize Your Workplace Performance and Personal Well-being Through Better
Oh, you got
Sleep.
a book. Okay,
I
great.
do,
So we
yeah.
can get we can get that on the notes
Yeah, we'll
too.
put that in there
We'll get
too.
that too. Great.
Excellent. Yeah. And that really just breaks down how sleep impacts how you function in the workplace. So your creativity, problem solving, learning, memory, all those things. And then specifically how to set your day up for work to get better sleep, no matter what work looks like for you. So if that is a 9 to 5 in the office, remote work, you're traveling, a rotating schedule, a night shift, it breaks it down for each type of set.
So as we get to the end of this, so what's something about sleep that you wish more people understood early in their lives?
Hmm. Earlier in their lives, again, I think I would go back to that mindset piece, the fact that you deserve to sleep and how you sleep impacts not only how you feel but your longevity, right? How long and healthy of a life that you live. One of my favorite quotes that I always leave people with is, instead of asking myself, have I worked hard enough to deserve to rest? I've started asking myself, have I rested enough to do my best work? And I think that when you go into whatever you do, as a mom, as a businesswoman, as a wife, as all these roles, with that mindset that I have to pour into me first, like how I sleep determines how I operate in those roles, it really switches everything around and it really gives you the perspective you should have when starting your day and your night as it pertains to sleep.
So I'm a really big believer in the holistic thing. Look at everything, not just look at things on their own. So we are dog people. I don't know whether you're a dog person or a cat person or you're not into animals or whatever, but I've
Mhm.
seen a lot of articles that says if you sleep with your dog, you get better sleep. Have you seen any research or anything to prove that that's true?
Maybe a
Okay,
dog
so
wrote it.
A dog wrote it.
in the sleep world, so I will say I'm not generally a pet person, but regardless, I like to look at things objectively. In the sleep world, we actually don't recommend sleeping with your pets only because it tends to impact your sleep quality, right? They move and they make weird noises and they grunt and all those things. However, there is something about sleeping with a loved one or loved pet. You get the release of the feel good hormone and oxytocin, and that alone can help relieve some anxiety and in some cases can help you sleep better. So I say generally speaking, it's not great for some people, but if you feel that you sleep better with your pet and you really do sleep well, I think it's okay as long as they're not impacting your sleep, waking you up in the middle of the night, all those kinds of things.
I mean, I personally don't because 'cause I'm a clean freak, so hair in the
Mm,
bed is a
Well,
not a
mm,
chance. So I personally don't, but I was just intrigued on that. So, well, this has been, excellent,
yeah.
really fascinating, and we'll make sure that we get your book out there and your show notes and the sleep guide and stuff out there. And we always like to wrap up with kind of the core values of our podcast, which is strength, kindness, and perspective. Is there someone in your life that embodies these values, someone who's influenced you or inspired your journey you'd like to give a shout out to?
Oh, I would say my husband. He's we've been together since college, and so he's seen me through all of these stages of life. And when I was struggling with insomnia, and now as a mom, and he's been so supportive in everything that I do, and helping me to be the best version of myself, and helping me to prioritize my health and putting my sleep and my well being first. So I would say, love you and thank you.
Mhm.
And, does he believe in mouth taping?
He does not.
Just kidding, just kidding.
They're still married, so I'm guessing no.
Exactly.
Yeah.